I'm going to discuss few questions from prioritization book. The first question here, the nurse on cardiac unit has received the shift report from the outgoing nurse. Which client should the nurse assist first? There are four options. Which patient I go first to check? And I said prioritization. Which patient need to go check first? Here, the patient number one, the client who has just been brought to the unit from emergency department, who with no report of complaint. Number two, the client who received the pain medication 30 minutes ago for chest pain, and that was level 3 on 1 to 10 pain scale. Which was the answer? Before to go answer, I want to share with you, number 2 is not an answer because your patient has a pain 3 out of 10. So it is very mild pain. And patient will not die because of this pain. And already patient given pain medication 30 minutes ago. They have to wait. So number 2 is not an answer because of the mild pain. Imagine if pain is 8 out of 10, 9 out of 10. This is the priorities according to the Maslow's law. Number 3, the client who had a cardiac catheterization in the morning and has palpable pedal pulse bilaterally. Number 3 is not an answer. Why? My patient had a cardiac catheterization. Okay, I understand. No problem. And during the checking, I felt our patient has palpable pedal pulse bilaterally. So wonderful. If pedal pulse is absent, it is indication for emergencies. So this client, I mean number 3, has been back from the procedure and bilateral pedal pulse indicate the client is stable. Therefore, this client does not need to be seen first. As like number 2 patient, it is important for the nurse to assess for the pain and pain relief in timely manner. But this client, I'm talking about number 2, this client has been medicated and the pain was 3 out of 10. And the nurse can evaluate the amount of pain relief after making sure that the other patient first. So number 4, the client who has been turning on call light frequently and starting her care has been neglected. So someone is calling call light frequently. Maybe nurse went for one time and complain. This patient complain. It is difficult to make them happy. And if you go a little bit late, patient will not die, who is pushing the call light frequently. So number 4, also not priorities. And about the number 4, I want to tell you psychological issues are important, but not more so than a physiological issues. Hmm? And according to the Maslow's law, we always go for physiological issue first, then psychological issues. And this client admitted from, number 1 patient, I'm talking, the client who has been brought to unit from emergency department. Although patient do not have a complaint, but it is talking about the ED, emergency department. And this client may or may not be stable. Who knows? This patient came from ED unit, and this client may have no complaint at this time, but the nurse must assess this client first to determine whatever the complaint was that brought the client to emergency department as stabilized. And this client should be seen first because of ED. Because of other patient is not the priorities. What next? Question number 2. Here, the nurse on cardiac unit is preparing to administer medication after receiving the morning change of shift report. Which medication should the nurse admin first? So there are 4 options. Which patient or medication we supposed to give first, right? This is the question. So first of all, let me see the cardiac glycoside to the client who has apical pulse 58. So question, it is important to understand. Administer first. Number 1 is not an answer, first of all. Whatever number 2, 3, I do not know, but it is not an answer because cardiac glycoside, I need to check the pulse. And if I get the pulse 58, I must hold it. I never give the medication first. Because the cardiac glycoside such as digoxin should not be administered unless the apical pulse is 60 or above. My patient is 58. I never give it. Then, number 2, the loop diuretics to a client with a potassium level 3.2. Definitely, it is not an answer as well. So I said, what is the normal level of potassium? It should be 3.5 to 5.0, right? So it is 3 means less than 3 normal. And loop diuretics causes the loss of electrolyte. So hold it. And we do not go for number 2 because the client's serum potassium level is already low. And the nurse should question administering a loop diuretics. Informed to notify healthcare provider. Number 3 patient, the anti-dysarrhythmia to the client in ventricular fibrillation. And number 4, the calcium channel blocker who has a blood pressure 110/68. Number 4 is not an answer because patient is very stable. If you go little bit late, this patient will not die, right? And number 4, I said the client's blood pressure is above the 90 and 60, 90/60. So the calcium channel blocker can be administered, but it is not the priority over the client who is life-threatening situation. But number 3, which is our answer out of all, I said others are not answer because of 58, because of 32, and this is normal. The anti-arrhythmics to the client in ventricular fibrillation or called VF. This is the priorities and answer. Why this is answer? Let me tell one more time. We chose, this is the answer because the anti-diarrhythmics medication or medication for ventricular fibrillation or antiarrhythmics is important for dysarrhythmia to normal, to get back the normal rhythm of the heart. This is important and is the first priorities, and we give this medication first, right? And let me recap it. I said number 3, this client in ventricular fibrillation is in a life-threatening situation. Therefore, the antiarrhythmic such as lidocaine or amiodarone should be administered first. What next? Next question, number 3. Number 3, we said the patient, let me explain and let me show here. Patient number 3. The client should the telemetry nurse assess first after reviewing the AA, means morning shift report. So 4th option, which patient you go and check first? Which patient you go and check first? Number 1, a client diagnosed with a deep vein thrombosis who has an edematous right cuff. So this patient, I will not go first. Reason being, why? Because the nurse would expect the client with a deep vein thrombosis to have an edematous right cuff. So the nurse should not need to assess this patient first because it is normal. Who is diagnosed the deep vein thrombosis, their right cuff supposed to be edematous. Expected findings. So I said because of this expected findings, number 1 is not answered. What else? The client diagnosed with mitral valve stenosis who has heart palpitation. The diagnosed with the mitral valve stenosis who has palpitation. Do I go first? Again, the person who diagnosed mitral valve stenosis, they have to have heart palpitation, and this is expected, normal for the patient. Palpitation means heartbeat is rapid, sensation of rapid, fluttering heartbeat. And if the patient diagnoses the mitral valve stenosis, it is normal as well. So it is not priorities. The number 3, the client diagnosed with atrial occlusive disease, who has intermittent claudication. Diagnose arterial occlusive disease. The sign and symptom, they have to have intermittent claudication and is the normal for them. So the nurse would expect the client with arterial occlusive disease to have the intermittent claudication, means leg pain. And it is normal for this patient. So the nurse would not need to assessment this client first. So number 3 is not answer. Number 4 is remaining. The client diagnosed with congestive heart failure, who has pink sputum. This is the priorities. You need to evaluate. You need to evaluate, then you have to notify healthcare provider. So that client would not expect, right, who have congestive heart failure suddenly have a pink sputum, because patients who have heart failure also have pink sputum. It is the sign of pulmonary edema. And this is the medical emergencies. The nurse should go and assessment for number 4. And this is the answer. Last question here. The client nurse, the charge nurse is making assessment for a client on a cardiac unit. Which client should the charge nurse assign to a new graduate? So out of 4, the patient who is stable, who has a minor problem, we always prefer to assign the new graduate nurse. So it is this question about the delegating. So there are 4 options. Who is more stable? Let me explain, and we assign the new graduate for them. Number 1, a 44-year-old client diagnosed with myocardial infarction, or shortly called MI, right? We never ever give this patient to the new graduate. So number 1 is not answer, because it's the emergencies. MI patient, and this client is at the high risk for complication related to necrosis myocardial tissue, and will need extensive teaching. Therefore, this client should not be assigned to a new graduate. Number 2, 65-year-old client admitted with unstable angina. It is also emergency. Unstable angina anytime lead to develop MI, and MI lead to develop congestive heart failure. So always the skillful nurse supposed to be there, not a new nurse. So number 2 is not answer, because unstable angina means this client is at risk for life-threatening complications and should not be assigned to a new graduate. And number 3 and number 4, A 75 years old client scheduled for cardiac catheterization. Schedule, right? Very stable. Number four, 50 years old client complained chest pain. This is also need assessment. We do not know this chest pain because of MI, because of unstable angina, because of gastric or pancreatitis. We do not know. So a skill aren't supposed to take care of patient number four. So four is not answer two, because I'm talking about the patient number four, that this client gave the permission when give the admission to the hospital for information to share among those provide the care. So I said we need to evaluate this patient first. So number four is not stable. Number three is the answer because this 75 years old need catheter schedule is done. Now need to monitor very stable. So a new graduate should be able to complete a pre-procedure checklist and also get this client to the catheterization lab. New nurse can do this, right? And